Welcome to Medicare School Daily. We're excited to be here with you today. We're going to be talking today, if you're going to be starting Medicare soon, 1 out of 4 of you are planning to do something that is actually a pretty big mistake. And so we're going to be doing a little education on that today, really in the hopes to prevent you from making that mistake. This show is brought to you by MedicareSchool.com. My name is Josh Music. This is my dad, Marvin Music. We've been helping people with Medicare since 2011, so a little over 15 years now. And we haven't seen everything, but we've seen a lot. And so the purpose of today's show and every day is to do some education, prevent you guys from making a mistake, maybe showing you how to get a little bit more out of your Medicare benefits, and then taking calls from you all. So if you have a question that you would like to have answered, you get the opportunity to speak to one of the really leading experts on Medicare in the country, my dad, Marvin Music. You can call in. There's a phone number that's at the bottom of the screen. The phone number is 833-824-2004, 833-824-2004. Ask any question, Medicare-related, retirement-related, Social Security-related, and we will do our best to help you. Want to mention just a quick housekeeping thing before we get into the big mistake that 1 out of 4 of you are going to make. This show right now is being streamed on podcasts, on whatever podcast app you're listening to it, and then also on our Medicare School YouTube channel. We are going to be transitioning the show to its own YouTube channel here in the next couple of weeks, and so we want you guys to be able to find it. So you can go to MedicareSchoolDaily.com. I think we'll probably put that up on the screen. MedicareSchoolDaily.com. Scroll down a little bit. Look for a YouTube icon. When you click on that YouTube icon, it will take you to the new channel, and you can click subscribe there. It's free to subscribe, as is any YouTube channel to subscribe to. But I want you to know, if you want to find us here in a couple weeks, we're going to move over to that channel. And so you need to go to MedicareSchoolDaily.com, look for the YouTube button, click on that, and then click subscribe on that new channel. Because before long, it will only be there. So let's hop into the education. Dad, why don't you talk to us about this mistake that 1 out of 4 people that are beginning Medicare soon are actually planning to make and don't know it.
All right. Sounds good. Well, people go on Medicare at 65, or they go on Medicare after 65 because they continue to work.
Or they could go earlier.
I guess that's true. Yeah, if they're on disability, that is a good point. They go on Medicare on the 25th month of having disability payments. I forgot about that. So, but when people go on Medicare, they are, of course, inundated with all kinds of information. People want to give them advice and opinions, and it can be quite confusing with really the conflicting information. And so what happens is as people approach 65, and let's just talk about that. There's some of you that have to start Medicare at 65. That means that you are no longer working, your spouse is no longer working, or you are on COBRA, or you're on TRICARE, or you're on a small employer plan, 19 or fewer employees, or you're on an Affordable Care Act plan. That's the 5 groups that have to go on Medicare at 65. And so this mistake is made by them, but it's also made by people that are not going on Medicare at 65. They're going on Medicare at 66 or 72 because they continue to work or their spouse did and they were covered by a group plan. Point being is this is a mistake that people make, though, when they either have to go on Medicare or they're going to because they're going to retire. Okay, and so when we look at that stage of our life, there are really 3 options that we have to choose from. We can take A and B only. We can take A and B with a Medigap policy. We can get an Advantage plan. Okay, so
those are the 3 options.
Those are 3 options. So let's say it again: A and B only, A and B with a Medigap or a Medicare supplemental policy. Those are synonymous terms, or a Medicare Advantage plan. And so what happens is people look at their options, this A and B only. Sometimes people draw the conclusion, hey, this looks like a good option. And really there's 3 reasons. One, they just look at the cost monthly. And they say, hey, all I have to do is my A is free for most people. My B is going to cost me a premium. And so I like that. I don't want to have to go out and pay for any insurance. Maybe they're healthy. They don't take any medication. So they just think, hey, this is very simple. I'll enroll in Medicare and I'll be done. And we get calls like that every day, people that have made that decision. And so what happens, though, as we're approaching Medicare, and the statistic here on 28%, there's 28% of all people that say that is a good option. Why? Because they look at the cost, or I think sometimes it's because they don't understand the consequences of that choice. And that's what we're concerned about. The consequences of having A and B only. You are now financially responsible for the balance of all the bills, because Medicare doesn't pay for anything 100% other than preventive.
So let's walk through those.
Okay, let's do.
Yeah.
So the gaps in original Medicare would be, what you have is you have deductibles.
So this is for somebody who's got A and B only.
That's right.
They're
That's
like,
right.
Hey, man, that's offered by the government. Whatever I've been paying to this system, just A and B is enough.
That's right. And they draw that conclusion. And so what I'm saying is they don't really understand the consequences of that. And so the way to look at it very simply is this. Medicare has gaps. Those gaps include deductibles. Those gaps include co-pays, co-insurance, and a thing called excess. So let's break them down. So if I had A and B only, the first thing I'm responsible for is if I'm in the hospital, I have to meet a deductible. It's not crazy high, but it's not annual. It's a deductible that can occur.
What is the deductible amount?
$1,736 this year.
So $1,736 deductible, but
That's
you
right.
said it wasn't annual.
It's not annual. It's called a benefit period deductible, which means when I go to the hospital, I start a benefit period, and let's say I'm in the hospital 10 days. I go home, I'm still in my benefit period for another full 60 days. So from date of discharge, my benefit period will last 60 more days, and then after that, it's over. And then if I get rehospitalized after that, I would have to pay another deductible.
So it's a per benefit period deductible.
That's
So you
right.
could have to pay that 2, 3, 4, 5 times a year if you timed it.
Yeah, exactly right. It could be that much for sure. And so I doubt it happens often, but it certainly can happen a couple times a year for people that are struggling with some health issues. And so we're responsible for that deductible. But if someone has a real serious illness and they're in the hospital longer than 60 continuous days, doesn't happen often, but it does happen.
Sure it happens.
And so on the 61st day on, we have coverage by Medicare. We have 90 days where we have these co-pays. And those co-pays this year, I think, are I want to say they're $438. Okay. And once you look it up real quickly, and $876, but you can look it up. But these are what we call co-pays for extended hospital stays. And so if you're
$434 for days 61 to 90.
Yeah.
So that month, because that's a month,
that's right? It's about $13,000 probably, something like that.
434 times 30 is 13,000.
There you go.
Yeah.
And then it's doubled the next 60 days. So
26,000.
26,000. So the point is, when people have a serious illness and we have an extended hospital stay, it's very, very expensive. If they have A and B only, they have no coverage for that gap. And then the other gap that's on the A side would be for skilled nursing facilities. And the way that works is this. Medicare says as long as you've been in the hospital 3 full days, 72 hours or longer, and the doc puts you then from the hospital into skilled nursing, they will cover everything the first 20 days. It doesn't cost you a penny. But after 20 days, if we're still in need of care, now we have daily co-pays. Those are $217 a day. So right now, the average is between about 35 to 40 days. So the first 20 is on Medicare, next 20 is on me. So now we're talking about $5,000 that I'd be responsible for if I had A and B only. And that's the A side. And those are serious, Josh, but the most serious issue is the B side. And because the B side, though it has a very reasonable deductible, $283. The problem is the co-insurance. So if I had A and B only, I meet my deductible, $283, it's once a year. Okay. But now I'm responsible for everything on the B side of 20% co-insurance. So Medicare
pays
pays 80.
Cap?
There is no cap. Yeah, so we have an unlimited out-of-pocket exposure on the B side of Medicare, and the problem with that one is that's where all the docs are paid. Whether I see a doc inpatient, outpatient, doesn't matter.
Surgery,
every doctor,
whatever.
It doesn't matter. Anesthesiologist, my therapist. I mean, anywhere you go, that you're going to see a professional, a physician assistant, a specialist, a primary care doctor. You have to pay that 20%, and it never stops. And so when people have a serious illness, this is a real pain point, because they're going to see a lot of docs and they're always responsible for 20%. And then the last one doesn't happen often, but they would be responsible for, and that's called excess. And this is when a doctor adds 15% to the bill. And so whenever that comes up and I have nothing, again, I'm responsible. So the whole point of this, if I had A and B only, I have a tremendous amount of risk, a lot of exposure financially. And this is the thing, honestly, that puts people in bankruptcy right here because they have A and B only. So they don't realize the consequences of that. They look at, hey, it's simple, I'll do it. I've been paying for it all my life. I don't want to pay for anything else. I'll get A and B only. And Josh, the majority of people regret this.
Sure.
Yeah. Now, someone, let's say they're a veteran, and they like.
Yeah, that was going to be my question. Like,
yeah.
who should have A and B only?
Okay. The only people that probably should have A and B only there's no one that should have A and B only without some of the kind of insurance. I don't believe it's ever a good fit for anyone. Even if I have A and B only and I get my VA, I would still do what's called a Medicare Advantage only plan. So they have to have A and B only to get that Medicare Advantage only plan. Someone on TRICARE, I feel the same way. A and B, TRICARE, and a Medicare Advantage only plan. Those are very, very attractive options. Those are the kind of people that I think don't even need a supplemental plan. If they're going to use VA, they're going to use TRICARE, they don't need a sup. But they can really take advantage of a good Medicare Advantage only plan. So let's go back. So they look only at the monthly cost. They don't understand the consequences, and then a lot of people just flat confused. Yeah. They just don't know what to do. And so
there's a lot of marketing stuff out here. I mean, everyone's
right.
telling you a different thing. Your friends, your neighbors, your sales agent, the TV, the guy on. There's just so much conflicting information surrounding what you should do. So people probably throw their hands up in there and say, I'll just have Medicare A and B.
Yeah. Well, and it happens all the time. So I would say this, that I think people need to realize most people you talk to are going to be conflicted in some way.
Yeah.
The majority of the market right now is conflicted, in my opinion, just towards Advantage plans.
Yeah.
Advantage, why? High commissions. Insurance companies push them. We're incentivized to sell those. But what I would tell people, it's us or anybody, find somebody that will be honest with you and tell you about the whole system.
Sure.
Make sure you understand the consequences of each of those choices.
So if somebody does A and B, because if you're listening to this, right, and you're like, wow, I've been on A and B for 2-3 years, that's all I have. What are their options now?
Okay, it's a good question. So right now, at this time, the only thing they could do is they could add a supplemental plan.
Okay.
Now, let's say they're just brand new to this.
What would that supplemental plan do?
Okay, well, the supplemental plan is going to fill in those gaps.
So the Part A deductible that you could pay multiple times a year, the $13,000 a month for the hospital, the $26,000 a month for the hospital, the Part B deductible, the 20% out of pocket, all that sort of stuff.
Yeah, exactly right. So, so when people get a supplemental plan, they're saying, I don't like the gaps. I want to transfer the liability of those gaps to an insurance company, and they buy a supplemental plan. Those are also called Medigaps. Top two plans today are the G plan and the N plan. They're both very good options. G is a little bit more comprehensive than the N, but N is a great, very close second. Sure. So as we work with clients all day long, there are some people that say, hey, Marvin, I just want the most comprehensive plan I can get. That's going to be a G plan. It is. Covers every gap but one, the B deductible. Others say, I like supplemental plans, but I just don't really want to spend quite that much money. Then get a budget-friendly N plan. Still a great option. Take on a little bit of risk. Honestly, not a whole lot more, but some, and probably save $50, $60 a month or more and still get the benefits of the supplemental plan. All right, and so point is,
so they can get a supplement
right now.
Probably have to answer health questions though.
Yeah, they may have to do that. If they're within their first 6 months of starting Medicare B, then no health questions asked. But after that, we'd have to ask.
Because that could also be something people think is like, well, I'll just take A, B for a while and I'll add something later.
Right.
The problem is it doesn't quite work like that, right?
No.
When it comes to a supplement plan.
Right. Yeah.
You have 6 months after your Medicare Part B starts to get a Medicare supplement like a Plan G or Plan N without any health underwriting, without any health questions asked. Beyond that,
that's right. Well,
they could just decline you.
Hey, yeah, exactly right.
They could rate you up, charge you twice as much. Yeah,
a lot of risk in not having anything. So the other thing that people can do if they say, well, I really can't afford a supplemental plan, then later this year, October 15th to December 7th, then they can add an Advantage plan. And Advantage plans have no underwriting. They will for sure get that. And that plan then would go into effect January 1st. And so, my view is when people can afford a supplemental plan, I think it is a very good option just because I think they get a lot for their money. I really do. But some people don't want to afford a SUP, or they can't afford a SUP. Then Advantage Plan is a wonderful option in that situation. So my opinion is this: the worst option is A and B only. It's the worst.
Which is what 1 out of 4 people are kind of planning on.
They're planning on it.
Yeah.
Fortunately, they will, once they get education, they'll realize. So I think when it boils down to it, I think about 5 to 6% of all people will end up there.
So most people correct.
They will correct. Okay. Exactly right. They're starting to, they'll talk to people. Sure. They'll understand the consequences.
Learn that risk.
But still some don't. And they'll have A and B only. And if they have a serious illness, they'll regret that decision.
I like it. Okay, we have several callers lined up that are waiting, so we want to hop to our phones. Guys, if you want to talk to us, talk to Marvin, get your questions answered. Phone number to be on the show is 833-824-2004. And then at any point during the show or any time, we have a team of people that work here at MedicareSchool.com, and their job is to help people understand in your zip code, for your health situation, for your financial situation, for your your budget, all of these things, what is the right Medicare coverage for you? And so we'll take our time. We'll look up your doctors. We'll look up your medications, the hospitals that you want to have access to. And then we'll help you find those options, because in any market, there could be, 10 or 15 different Advantage plans to compare from, 5 or 10 different drug plans, a host of companies that offer Medicare supplement plans, and you want to find the one that really makes sense for you. And so as brokers here at MedicareSchool.com, we have all the tools to walk you through that process in an hour, hour and a half, so that you can live your retirement confidently, not confused about what's going on with all these TV commercials and my friends are telling me this, that, and the other. We really want you to have confidence. So that's the goal of everything we do here by doing these shows, our YouTube channel, and then even the team that we've hired is to walk you through that process. So
let me add this, Josh, real quickly. I think, too, when we serve our clients, there's 2 things. Number one, there's going to be no pressure. Yeah. The agent will not put pressure on you, and also the agent's not conflicted because they are paid the same. I mean that. Most agents are incentivized to sell Advantage. It doesn't work that way here. When we start our company, we say we're not going to do that. We do not incentivize the agent to push anything at all. So just know you'll get unbiased information when you talk with us, and that's the way it'll always be here, as long as we own this company.
Okay, let's go to the phones. Hello, welcome to Medicare School Daily. What's your name?
My name's Charles.
Hi, Charles. Where are you calling from?
From North Carolina.
Charles,
Alrighty.
North Carolina.
Good to have you today, sir.
Welcome. What can we do for you, sir?
Well, I'm a veteran from the military.
Okay.
Served 6 years and have an honorable discharge.
Okay.
And I was listening to one of Marvin's podcasts not too long ago, and he would. I think the question came up about VA health care.
Okay.
And so I guess my question is, he was saying something about rather than doing a supplement plan, he said you could also do an Advantage plan with without a drug, because of the drug coverage that the Veterans Administration has.
Yes, sir.
Can we ask you just quick, are you already on Medicare?
I am on right now. I retired in January.
Okay.
And so I'm on Part A and Part B as of January. I haven't picked out a supplement plan just yet.
Okay. Let me ask you this, Charles. Are you satisfied? Happy with everything that's going on with your coverage at the VA? Is it meeting your needs?
Well, I haven't actually been there yet.
Oh, okay.
I just applied because I was going through the application, and one of the questions on there is about income, and that was going to put me in, like, I think they have different tiers or something like that, and I was going to be in. I'm not exactly sure where I'm going to fall in, so I kind of stopped, and because I know once I retire, my income would be much less.
Sure. When are you going to retire?
Well,
I retired in January.
Oh, in January, did. Okay, very good. So when you fill that out, okay, I got you. I misunderstood that. Okay, so here's my view. If someone is secure in and they're very happy with the VA system, and there's good reason for that. Some people are not, but the majority of people we deal with are happy with the VA system. And so what we recommend then is, if they are, to not get a supplemental plan in instance because, my opinion, it's a little bit too much insurance. Now, I have lots of clients that like the VA and they still have a supplemental plan, honestly, because money is no issue. They said, hey, I want the best. And if I don't want to go to the VA, I don't want to, and I want to be able to go where I want to go anywhere in the country. Okay, that's a supplemental plan. So, you live in North Carolina, rates are very good there. You can probably get a good G plan or an N plan for maybe 110 for an N.
What's your zip code, Charles?
Okay, very good. And so Josh will look those up real quickly, but so you can get a G or an N plan.
And we're in Transylvania County because it's going to ask you that.
Okay. And what's month and year of birth for you?
October 1958.
Okay, October 58. Okay. Thank you.
All right. So you turned 67 last year, so he's 67 right now. All right. So
yes, sir.
Back to what I was saying. So if we're happy with the VA and we feel like we're going to stay in this system primarily, then the majority of people would like to have a civilian option just in case. They want to go outside. They want a second opinion. Maybe if you got the flu and just want to go see a quick doc or something, we have to go to the VA. So the civilian option would be then, in that instance, a Medicare Advantage only plan. MA only just means that, as you heard on the last podcast, the Medicare Advantage company is not responsible to cover your medications. You're still going to get those to the VA. And so because they don't have to cover the meds, they're going to give you a credit back on your Medicare Part B, which means if you're on Social Security, that give back increases your Social Security check. If you're not on Social Security yet, you still get it, but what it does, it reduces your Part B premium. And right now, those vary anywhere from like $100, $120 a month upwards to $175 or $180 a month. So it almost covers the full Part B premium, or maybe 2/3 of it. And so we can look at that for you. So if someone is happy with the VA, I think MA only plans make sense. They do. But if someone's not, then, and Josh will give you some rates here. Looks like, is these your G and N's? Yeah. Okay, so your G plan right now, lowest G in North Carolina right now is about $150 a month. Good company. And then the N plan is about $100 a month. So if you said, hey, I still want to be able to go to, Mayo Clinic, or I still want to go to, MD Anderson or wherever, most of those places don't take Advantage plans, so they still wouldn't take your Advantage plan. But if you wanted, the Cadillac of Cadillacs, then you can still get certainly a supplemental plan. You don't have to get a drug plan because you can get your meds to the VA. All right, so that's what I was trying to teach. I would never discourage someone ever from getting a supplemental plan, but if they said, hey, I don't want to get that, I really love the VA, it's worked good for me, then use your Medicare benefits by getting the MA only plan, get some benefit out of that. Because if you just had A and B only and you have the VA, I just don't think that's the best position to be in. A and B would be still okay. That's what we mean by that. And
I'm seeing when it comes to those MA only plans, probably a reduction somewhere about $100 to $150 a month.
Okay, very good. So Josh, you heard what he said, $100 to $150 a month back on your Part B. So to me, because VA is not going to bill Medicare, Medicare is not going to pay the VA. It doesn't work that way. They're just two separate government agencies that will not pay one another. So if you wanted another option, that civilian option, to me, that just makes sense. So any other questions, Charles? We'll
So I guess to wrap up, it sounds like my best option would be to probably go ahead and get a supplement plan now, because I can definitely afford one without a problem.
Okay.
And if I do like the VA, then I could switch it another time, I guess, right?
Then what you would do, you could then drop your supplemental plan in the future if you said, hey, I'm never going to use this. So then, and that'd be fine. But this would be the time to get it, because there's no underwriting involved at all. You're still 6 months within your B date. I'm assuming January 1 was your B date. Would that be correct?
Yes.
Okay, very good. So you're fine. You got up to 6 months.
Same as yours, I believe.
Yep, that's when I started. Other than I'm not quite as old as you. I'm in no hurry. Yeah, I turned 65 in January. So, but you're fine up until that'd be all of January, February, March, April, May, and then June. And that'd be your last, June 30th would be the very last day that you could submit a supplemental plan with no underwriting involved. And that plan, of course, would start July 1st. And if you want to do that, Charles, we'd be delighted to help you. Call in. agents can tell you there's different companies, and we're not able to give that over the air. But you call in, we'll help you. Let me give you our number in case you don't have it.
I understand that.
Yeah, the number.
I've got it.
Oh, you got it. Okay, very good. So yeah, and they'll transfer you live, and I promise you, every agent that's on our team, I know, Josh knows, we train them. They work for us, and they're committed to really helping people. So we'd be thrilled to be your broker. Go
I
ahead.
want to back up just real quick. So does he also, when he calls into us, does he need to get a drug plan as well, or not?
No.
Just
No.
use the VA for any prescriptions.
Right. Yeah, it's credible coverage, and if you can get a drug plan if you wanted to, and in fact in North Carolina there may
there's a drug plan for $3.60.
There you go. Now the only reason.
Yeah, that's what my wife is on.
Oh yeah,
Okay, good.
There you go.
And you know what? That's not a bad option. I'm going to tell you why. Because I know sometimes we'll have VA facilities where even if you don't get the medication prescribed by a VA doctor, they'll still fill that prescription. But I've heard others tell me, hey, the only ones they'll fill are those that are written by VA docs. And so I've heard both sides of the story, honestly, and I don't know. So $3.60 I'd probably get it just in case,
Yeah, and plus I guess another thing would be if the VA does a prescription, I guess you could either get it by mail or you'd have to go to the VA to get it. Is that correct?
Yeah. No, I think they'll mail you prescriptions. I'm not on that, but I believe that would be.
He's saying, can he go to CVS with VA stuff?
Yeah.
And get meds filled?
Oh no, I don't think so.
Yeah.
No, I think they'll mail you meds, but
Mail it or
otherwise
have to go to the VA.
Exactly right.
Okay.
Yeah. I've never heard someone tell me that they're able to get them filled, by CVS or Walgreens or Walmart or someplace. So this way you'd be able to, and if it's an expensive medication and the VA prescribed it, then you're probably going to get a better deal to the VA. But at least, if not, it still would probably be covered by your civilian plan. Okay, and you can have both. It's not a problem at all. No issue.
Yeah, you'll be covered well.
I did notice one thing. I was looking at I was digging around the VA website a little bit, and they do have discounted dental plans if you don't qualify for their dental. And I was kind of curious if they had vision, but I don't see anything on there for vision. I think they'll just cover the eye exams. I think as far as glasses, they don't though. So
yeah, but and they probably won't. But your Medicare will everything but that eye exam and glasses. So you can get a vision plan. They're usually about $15-20 a month. But I recommend people only get a vision plan if they get glasses, because your Medicare is awesome coverage for everything vision. But if you wear glasses,
my wife and I both wear glasses, so it would be a good idea for us.
You probably get your money back out of that plan. Okay, and when you call in,
I think so.
The agents can tell you about the different options. Sometimes they can be standalone, they can be added to a dental plan as well.
Okay.
All right, you good to go?
Thank you so much for talking with me.
Yes, sir. Well,
thanks for calling in.
Thanks for
We
calling.
look forward to helping you. Appreciate it, Charles. Thanks.
Bye-bye.
Yeah, take care.
It's interesting, just everyone's got a different opinion, because so many vets, I think, will take advantage of a Medicare Advantage plan, get that Part B buy down, which is good. But you're still in kind of networks and all that stuff.
Right.
So he's more saying, I just want full coverage.
Yeah.
So give me the best civilian, and then he can use VA as a backup.
Yeah.
And that's probably makes sense because he hasn't been using the VA.
Yeah, he didn't know for sure what they're going to offer him yet.
Yeah.
Yeah.
And even then, after a couple, let's say he just falls in love, and he's got a great VA doc, and and he's 5 minutes away or whatever, then he can just drop his supplement plan down the road and just use that pretty much exclusively. Now, for my knowledge, Medicare and the VA, they don't bill each other at all, right? It's going to be two.
My understanding is that's right. VA won't pay. They will not bill. Medicare will not pay VA. Okay, that's what I've been told. So
you're kind of saying, hey, I've got VA, but I've also got the full Monty.
Exactly
when
right.
you have a supplement and a drug plan. Okay. Spread something said, I'm thinking of retirement perhaps next year. Right now I have insurance through my job. Did I understand you correctly that I can't sign up for Part B for Part D until October instead of when I sign up for a Medicare plan, say in May?
Okay, no. Anytime someone has, let me see that again. I'm thinking of retirement next year. Right now I have insurance through my job, but I can't sign up for Part D until October instead of when I.
Yeah,
okay.
He's mixing up.
Yeah, and I'm sorry that maybe I brought about some confusion there. So whenever someone already has a Part D plan, and they want to change that plan, then the dates would be October 15th to December 7th.
But when you're first signing
Medicare, you can actually start a plan when you first go on Medicare, or you can do it within 63 days of losing an employer plan. But the key is that if someone's going to start Medicare at 65, then they have the same period of time, 3 months before they can enroll, month of 3 months after to get a Part D plan. But if I'm going to come into Medicare D later, then I can do it in advance of my retirement date, or I can do it within 63 days of when I lose my employer coverage. Okay?
Yeah, so if you are, because this can be confusing.
Yeah, it is.
You know, we talk about a lot of different situations, a lot of different enrollment periods. It can be confusing to try to keep your situation, figured out and straight. So if you are retiring, maybe you're 66, 67, 68, you're past your initial enrollment period, past 65, and you've had coverage through your job, and let's say you retire in May like this person, you absolutely can start your drug plan and your other coverage at that time. You don't have to wait until October 15th like people do if they were switching. Now, the only time you may have to wait, and this isn't this person's situation, is let's say you took A and B, right, and you kept working, but maybe you didn't have coverage through that or something. Just kind of the situation we talked about earlier, right? You retire. At that point, you would, because you didn't have employer coverage, you didn't have 63 days, you would have to wait until that October 15th to enroll.
Exactly right.
But October 15th to December 7th is generally for people who are on coverage already that want to make switches.
That's right. Advantage and prescription drug plans.
Yeah, not supplement plans. Yeah. Okay, I think the caller is back. Let's hop on that. Okay, welcome to Medicare School Daily. What's your name?
My name is Jason.
Jason, where are you calling from?
Calling from Lansdowne, Pennsylvania.
Pennsylvania.
All right, sir. Good to have you on the program today.
What's your question, sir?
Oh, thank you. You guys do a great job. I've watched your videos. They're really excellent.
Good.
Good. Thank you.
Yeah, thanks for the encouragement.
You're welcome. I just have a couple of calls for you. I mean, a couple of questions, excuse me. The first question is I've been doing some hunting of my own on Medicare.gov, and I came across a policy, a Plan N. I think it's Physicians Mutual. It's called a Plan G Innovative. And I haven't come across anything like an innovative plan at all, or what does that mean, innovative?
Yeah, why don't you tell, what's your understanding of it based upon kind of what you've been reading?
That there are savings in this, that it's sort of like the deductible high G deductible, I think, or something like that. And that there are savings over time.
Okay. Yeah, what it is it would be a high G plan for up to a certain period of time. I think theirs is, 3 years? Is that what it says?
Like that, yeah.
So what would happen is for your first 3 years or up to 3 years on that plan, you'd be covered by high G. And that means that Medicare pays and your G plan will not pay until you've met that deductible. This year it's about $3,000. And so then once you've met your deductible $3,000, then your plan will pay like a normal G plan would. Which G plans are great coverage. So that's what makes it innovative. And then what happens is during this 3-year window, they give you the chance to be able to convert it to a normal G plan, come off the high and go normal. So during that window, let's say you did it for the 3 years, what they're saying is that you save those premium dollars. So right now, let's just say your normal G is I'll just make it up, $150, and your high G is $50. So you're saving $100 a month. So you would have saved during that 3-year window $3,600. But you're also on the hook for $3,000 every year for a deductible. And some people are willing to take that risk and others are not. So I would not knock that at all. It just depends
on
the
plan. It's a plan we sell. We don't sell a lot of it.
Yeah,
but it is something in our arsenals.
Yeah, if you're comfortable with that. But that's the difference. But here's the issue. Sometimes people go on a high G plan that's not innovative, where they don't have the right to be able to convert to a G without underwriting. And then what happens? Their premium's a little bit lower, but then if their health changes, they can't get off of that high G the rest of their life because you got to medically qualify to get off. So that's the risk. But I'm not saying you'd assume that with physicians, since they give you that window of time to do that. Okay.
Thank you very much. I had another question.
Yes, sir. Hey, Jason. Jason, can I share one more thing, just real quickly? If it were me, I would lean more towards if I was going to save money, I'd lean more towards the N plan than a high G. That just to me makes sense because the likelihood of excess charges is very, very slim.
Well, even in Pennsylvania, it's not.
Yeah, they can't even charge them there. Yeah. Exactly right. So, anyways, that's probably what I would do. But go ahead. And I didn't mean to cut you off. You had another question there. I just wanted to finish my thought about, because you had mentioned the N. So go ahead.
No, you anticipated my question because I was going to say I'm drawn to the N plan, which is a lot like the G, except for the I guess, excess charges and then the deductibles. But the thing is, I came across a really good company called INA. Mm-hmm. The problem is that it's only been around for 1 year, and I've heard it said that you want to avoid all companies that have not been selling supplement plans for at least 5 years. They were ACE, I think, before that, and then ACE closed its books and then went into a new business. I don't know whether it's going to be stable if I go ahead and take this with INA, but it's got a great price. The price, you can't beat it. It's like $129.43 a month, which is in line with my budget.
What's your year and date of birth, or year and month and year of birth? Sorry.
My month is October of 1961.
Okay. So, and then your zip code?
Zip code is.
Okay. So it'd be 65 in October.
Okay. Delaware County or Philadelphia?
Delaware County, exactly. Okay. Delaware County.
So, and we write. I mean, we've done a fair amount of business for INA. We did a lot of business with Ace Chubb. They're both a kind of subsidiary of Chubb, so we're very familiar with that. That kind of block of business came out maybe 3 years ago. That first original one with Ace. And a lot of people went into that because they undercut the market pretty hard, and they're kind of trying to do it again with the INA book of business.
Exactly.
You are right that they're. I mean, I don't know. It's hard to say right now with, from a premium stability perspective. There's a lot of carriers that for years, heralded that they had a 2 or a 3% year-over-year rate increase, for decades, and then all of a sudden they're getting hit with back-to-back 20, 25% increases. I can't say the name on air because they always yell at us and tell us to take the episode down. But it's one that you know of, right? So, but that rate stability thing has been a little bit just different the last couple of years than maybe what we've had. I will say there's another company, like for instance Cigna, $5 or $6 more a month, maybe 10 more than there's Aflac that is $6 more than the INA. So you have Humana's $7, $8. You have a bunch of options right within that kind of $100 to $110 range that that you can look at too, which is good.
Would you say avoid the INA, or would you say that they're pretty good?
Not saying that. It really depends on everyone's situation is a little bit different in every parts of the country. There's different competitive plans. Like you just have a bunch of different options. Do you you live with anybody?
Are you married?
No, unfortunately.
Okay.
I'm not married or anything.
Okay. Yeah. Well, we just asked because of household discounts. Josh was checking on that. So, hang on. I just want to take a quick look.
I pulled up some quotes. He's looking at them.
Yeah, exactly right.
Jason.
Jason, it's hard. We love to have a crystal ball like you would to know who's going to be most stable. I will say this to you, though. I would not be afraid of them. Okay, Chubb is a great company. They're huge. So I wouldn't be afraid of them if you're comfortable with that. But again, like Josh just said, hey, Aflac's close. Aflac's book of business is managed by Aetna. They've been fairly stable as well. Anyway, so yeah, you just got options. That's what makes it tough. It's not like a no-brainer here. But if you're leaning that way, I would not try to dissuade you from it at all. Okay. Yeah, we still have a lot of people are in that ACE block because we wrote a lot of that business, and some are very pleased. Other parts of the country went up more than what we were pleased with. Yeah. And let me ask you this: Are you fairly healthy?
Yeah, I'm fairly healthy. I don't make very many trips to the doctor at all.
Okay, good. No, you're not on any kind of serious medications. Treating something that's like chronic.
Not. Well, I'm taking. Ariproprazole.
Omeprazole?
Ariproprazole.
Okay.
What's it?
Yeah.
And then also atorvastatin.
Yeah, that would be no issue whatsoever.
Okay.
Yeah. Okay. Ariprazole.
Ariproprazole.
Okay, very good. Okay, yeah. Anyway, so I asked that because sometimes people are on medications that we can't get through underwriting, and my whole point even ask you that is that as long as you stay fairly healthy, we can get you moved. And I'd say, Josh, probably 4 out of 5 people that call in that are clients or call in, we can usually get them through underwriting.
Yeah. So while a Medicare supplement plan, a med supplement plan is yours for life, you don't have to keep it for life, right? We actually encourage people if they're healthy, they can move, change blocks of business every 3, 4, 5 years. Why not? You kind of get into a block of business with younger, healthier people.
Exactly.
But the good news is, if something does change in your health, right, and you got something serious going on, that insurance company can't rate you up because of your health situation. They can't cancel you, right? It is yours as long as you keep paying that.
Yeah, you'll be grateful you have it.
Yeah,
in those kind of situations. No, and then also with us, if you decide that you want us to be your broker, you can call in anytime, and we also reach out to you throughout the year, making sure that you are pleased with your price points. So we'd service you on that.
We do our best to reshop each of our clients. It's kind of a new thing we're started kind of last year, is just reshop all of our clients' insurance every year to make sure, and we actively do that, reach out to see if there's ways we can save you money.
Yeah, in the old days, we didn't have to do that. I mean, rates were so stable.
No,
in fact, we had about 97% of our people just stayed on their plan. But that changed, with COVID and after that and all the inflation issues we've been dealing with. But we'd be happy to help you, sir. Anything else, Jason?
That'd be awesome. You could definitely move me if it turned out to be if they closed the block like they did with ACE.
Yeah, for sure. But the people with ACE, I mean, they're still happy. They're not. I would say they haven't taken, even though that block is closed, they're not taking bigger rate increases than anyone else.
That's true.
So there's not a huge concern there. Hey, Jason, do you have the phone number for our office to call in and talk to one of our advisors?
Actually, I talked briefly with Sarah Mullins, and she's very good.
Yeah, she's very sweet, very kind.
That's great.
Awesome. Well, if we can help you, please let us know. Call our office, call in. We're here for you, okay?
Appreciate you calling in, Jason. Yeah, take care. Have a good
Thanks very much for your answers.
You're welcome, sir.
Take care. Let's talk a little bit about, let's answer one of the questions from our YouTube channel. Adrian says, can you use any of these plans in Europe while on vacation as an American citizen covered by Medicare?
All right. And the answer to that would be yes. We have, of course, 10 supplemental plans, and 6 of those have what's called foreign travel emergency benefits, 6 of them. So the ones we primarily write, G and N, of course, do. So what happens is in Europe, Medicare will not cover anything at all. So what happens is the 6 of the 10...
Europe won't cover anything at all? What do you mean by that?
Well, when I'm saying that Medicare will not cover...
Yeah, Medicare's not going to cover. Yeah, and Europe isn't going to bill Medicare. Europe isn't going to cover anything at all.
That's for sure.
Just try to get on an airplane back fast.
My bad. Okay, Medicare's not going to cover anything at all. While you're in Europe.
Yeah.
So you have no coverage from Medicare outside.
This is original Medicare A and B with a supplement, right?
That's right.
Okay, so then we can talk about Advantage too.
Yeah,
it's a little different.
Yeah, Advantage would be, in my opinion, even worse.
Okay.
So, but when it comes to Medicare, they pay nothing outside the 50 states or the U.S. territories. So you're on your own. So what happens with the supplemental plans, 6 of the 10, they will give you $50,000. It's a lifetime benefit, which is called foreign travel emergency. So I'm in Europe, and let's say I take a fall. I've had that happen to people before, and we have a claim of $10,000. So what would happen with that claim, Medicare's out, of course, so the $10,000 claim in Europe, you would have to meet a deductible. That's $250, not much. And then the insurance company takes the balance of that bill, in my example, $9,750, and they would pay 80%, and you would pay 20%. And their 80%, though, runs out at $50,000. So I had a lady, the worst case I've had so far was a lady that was in Ireland that got ill. Something went wrong with her liver. She goes to the hospital. She was there 4.5 weeks. The bill was $172,000 in Ireland. And of course, her policy did pay the $50,000, but the balance of that was her responsibility. So what she did, and of course, she had no idea. She was on vacation that there was any problems would occur. But she bought travel health insurance before she departed. And she had $100,000 of medical travel health insurance, and it paid the $100,000. So her med sup paid $50,000, her travel health insurance paid $100,000, so she had to pay that $22,000. All right, and we encourage people.
How much is that travel health insurance?
It just depends on your trip, and are you just going to get medical only? If you got medical only, that's fairly reasonable, probably $100.
Okay, so this isn't like you have a rainy, like you want to cancel your trip. This is health insurance.
You can add that to it.
Okay,
but I'm just saying if someone just got medical, then I would say it's probably $150 for the trip.
Yeah, I've bought it before. Yeah. I feel like it was gone for like 10 days or whatever. It was like $200.
Yeah, it's not very much at all. But sometimes people will tie in trip cancellation or whatever, go that stuff. They'll write it all. But the good thing is all the policies will also offer air evacuation. So if I'm somewhere where I can't get proper care and they got to bring an airplane in. Yeah. I had a lady that fell in Costa Rica, fell getting out of the shower or tub. Anyways, breaks her femur, breaks her hip. So they truly put her in a van, moved her from Costa Rica, somewhere else in the country, 10 hours. And they thought that she would take care of her. There she could get care. She couldn't. Sure. So then they brought a plane in from San Diego, and it was like $300,000.
And it covered it.
Covered it, yeah, because they usually cover up to $500,000. There's some that'll go up to $1 million. For air evacuation, right? So again, that's almost
she got
always
a private jet ride.
Yeah, she sure
that
did.
She didn't want.
Yeah, but she's in a resort. So those kind of things happen. So I just say, hey, well, of course I wasn't on Medicare when it happened, but I was in Germany and had a retina detachment and was not about to get operated on in Germany, and they may have done a great job.
Sure, probably. Probably been robotic. Been like precision.
I had to stay a month though because of the gas in the eye. So I hopped a plane and we headed back to the U.S. immediately. Yeah. But my point is, trips do get interrupted. So sometimes people like to get that added insurance, and we don't sell that. That's not.
We should though.
Yeah, we should. Yeah, we have a lot of people ask about it.
We'll work on that.
We should.
Yeah, it can't be that hard.
No, it's not. Yeah, they've approached me many times.
Oh, well, let's just set that up. It'd be fun to bring someone on the show and talk about it. Yeah. Just the different options, how the policies are structured, how much they cost. Like, I wonder if it varies. I imagine it varies where you go too.
And how
like if you go to Germany versus going to Costa Rica, I feel like those are two. I've been to Costa Rica and to go 20 miles takes an hour and a half, right? 2 hours because it's crazy roads.
And the risk of the country too. I went to Israel and that was a little bit higher because it was Israel.
Interesting.
So that's what happens. But.
It's interesting. Okay, let's get to another question off the channel. So, can your company also help enroll in Social Security? Asked by Charlie Mo Money.
Yes, sir, we can. In fact, it's very easy to tie in the Social Security and the Medicare application at the same time. We can actually do that 4 months in advance of when you want to start Social Security. Medicare is 3 months, but when you do Social Security at the same time, they will also ask you the Medicare question. So we'd be happy to help with that. Now, if you're not a client and you just call in and want us to help with Social Security, we're not going to do that, that's not possible. But if you're a client, we are more than happy to help with that.
Yeah, because a lot of times when we're doing the Medicare application, Social Security application can be done at the same time.
Oh yeah,
right?
Yeah. Well, now it is the same site now.
Okay.
Yeah, if you're going to do Medicare only, you get a chance to say that. If not, you just keep on going, and they'll ask you the Social Security questions.
Has it gotten simpler or harder?
No, I think it's the same. But it used to be kind of we could say A and B only, or we could do Social Security. Now it's all the same app.
Interesting.
And they'll ask you, do you just want Medicare? So when you say yes, you got an A and B app. If you say no, they're going to continue on with Social Security questions.
Okay. Psych Nurse says, while on Medicare A and B, may I get my company dental and vision only? I have no HSA.
Yeah, almost always.
Often, yeah.
Very, very common because the dental and vision would be ancillary, would be separate type of a coverage. But most employers will let you keep that.
So this situation, let's say you continue working, you decide, hey, I'm going to go on Medicare because it's just better coverage, it's cheaper, lower out of pocket, whatever, it's comparable. So you just go on Medicare at 65, still working. But then you can often keep your dental and vision.
Exactly right. Yeah. That's the way I did with us.
Yeah. We've been recommending people do that for forever.
Exactly right. Yeah, it's usually better because it's going to be a group plan. Your premiums will be a little bit lower.
Yeah.
you'll save some money that way. And so I think it's a great idea if you like the coverage.
Yeah. Hey, guys, if you want to be on today's show or any show, call in. Phone number is at the bottom of the screen, 833-824-2004. We'd love the chance to talk to you, get to know you a little bit, and just kind of walk you through how we think about Medicare in your specific situation. My dad has answered, I don't know, hundreds of thousands of questions maybe. I mean, we've done hundreds, maybe 1,000 workshops or so live. There's always a Q&A. I mean, there's probably not a question he hasn't been asked is the point. But, of course, you can try to stump him. Yeah. If you've got a Medicare story, good, bad, ugly, just something you feel like it would be valuable for our caller or our listeners to hear, if you've got a story like that, we'd love to talk to you. There's a lot of horror stories out there. There's a lot of great stories about people who had $1 million, $2 million worth of bills, and they had it covered by a supplement plan, and they had to pay their deductible. Those are always stories that are exciting to hear and great for people to understand kind of what happens in this big world of Medicare. I'm going to just mention, again, this show is going to be transitioned off our main Medicare School YouTube channel. So you need to go to MedicareSchoolDaily.com, MedicareSchoolDaily.com. Look for the YouTube icon, click on that, and that'll take you to the new YouTube channel where you can subscribe to make sure that you see this show. We're going to transition off here in a couple of weeks, so it will be only on that new YouTube channel as well as on whatever podcast platform that you listen to. I think it's streaming to all of those as well. Let's talk about tomorrow's show. We're going to be talking about AI a little bit. Now, AI is a big, scary thing that we're all scared is going to take all of our jobs, but it also can be really helpful. And so we're going to talk about how some new AI technology is helping people, could help you get your medications approved faster. So we've talked a lot about on the show about prior authorizations and step therapy and formulary exceptions and all that sort of stuff. So there's some stuff coming out related to AI and how it can help you actually be a good thing, getting your medications a little bit quicker. We're looking forward to being with you all tomorrow. See ya.